It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Here's how mini dental implants will change your life.
I've had problems with my teeth.
I couldn't eat almost anything.
I'm gonna go and get this done.
There was no pain. I was very comfortable.
It's just unbelievable what it's done to my life.
And it makes you feel good. It does.
Kind of gave me my life back.
Many dental implants made me feel like me, made me feel the person I knew I could be and always was inside.
I would recommend it to anyone.
And now I can smile and show the world. Literally changed my life.
It's incredible. It is. It's absolutely incredible.
Hello, everybody, and welcome to Innovations in Health. I'm John DeSciullo. We're talking about the mini dental implant, a procedure that will change your life where you can be you again. I'm welcoming Dr. Bob Harvey and Dr. Rameek McNair from the Aspire Dental Group, a mini dental implant center of America in Lake City, Florida. We are excited to have you here because we're going to talk about this procedure. It is 5 times less, everybody, less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive. An FDA-approved product. Imagine, everybody, the foods that we love in Lake City, Florida, and all about the great state of Florida and southern Georgia. Steak, corn on the cob, seafood that is so prevalent here, sweets, sweet tea. That sense of taste is going to come back with the mini dental implant and without fear of those dentures falling out. So, doctors, we're going to get to know you in just a little bit, but first I think we should talk about the mini dental implant procedure. And Dr. Bob Harvey, show us the difference between the conventional implant and the mini dental implant.
Well, a conventional implant requires a hole being placed into the bone, and this model depicts just that. We use a series of larger drills to generate this hole, and in doing so, as the hole gets bigger, more cells are disrupted. With a mini dental implant preparation, we'll look at it and we'll see that it's very tiny compared to the other, and we're drilling a pilot hole which is considerably smaller and less invasive to the bone.
And just take a look, the size of the hole itself would dictate that the mini dental implant is a much better procedure and much more revolutionary.
1.2 millimeters.
Dr. Rameek McNair, welcome to the show. And you know, if you have a denture, a lower denture, I know swims around on the bottom of the gums and it's not stable, but the mini dental implant will make this perfect. Show us how.
I tell you, John, we have so many patients that complain of their lower denture. It's all over the place, it doesn't fit, I can't eat my steak. But with the mini dental implant here on the lower, we place 4 mini dental implants, and then there's housings on the inside of the denture here. And then it just simply snaps in, and then you can say goodbye to the goop.
Goodbye to the goop, that adhesive, you swallow it, it tastes so terrible. And
yes.
I can't imagine what that's like. So if somebody has a lower denture that's used to swimming around, that titanium post is what stabilizes it and holds it into place.
Yes, sir.
That's terrific. And odds are if you have a lower, you probably have an upper. And what's significant about the mini dental implant is that the upper denture example brings that sense of taste for the foods that we love here in Florida. Show us how it's stabilized and how the taste buds are now exposed.
With an upper denture, one of the keys that we need in order for an upper denture to be successful is to have a palate to it. And when I say a palate, that means that the denture actually covers this whole area in here. This is all filled in with plastic. That creates a suction cup effect. You have to have that in order to wear an upper denture, otherwise the denture will drop. There are other advantages of opening up this palate, and one of the keys of opening up the palate is to allow room for your taste buds to be exposed, to be able to taste foods. Most people think that the taste buds in the tongue, well, you have it in the palate as well. It also helps, if your palate isn't covered, to discern hot and cold.
And what makes that terrific is it stabilizes it and the sense of taste comes back. So people who are maybe not getting the kinds of taste that they love with their corn on the cob and the steak, not only are they secure in biting into it, they can taste it again.
I had a lot of difficulty in eating.
I couldn't eat 3/4 of the food that I enjoyed eating because I couldn't bite down on anything.
But with these, I can eat everything. Well, you got to eat for the rest of your life. Do something now. So I did.
I can eat everything. It's unbelievable.
It was done, over, done. Let's go home and eat.
I can eat steak, I can eat sandwiches.
So it doesn't slide around or move or worry about it falling out.
I had dinner 45 minutes later.
I don't have any problem chewing anything.
And my teeth aren't falling out of my mouth.
I can eat anything I want. I'll smile at anybody, you know. It's outstanding. I'm happy. I'm very happy.
I'm very, very pleased that I have them now.
So if you're out there and you have dentures and you've resigned yourself to the fact that that's how you're going to live with the dentures, not anymore. The mini dental implant will change your life. But Dr. Rameek McNair, there's another example that sort of takes the mini dental implant to another level. Show us with what we call the fixed on 6.
Yes, the fixed on 6. The great thing about the fixed on 6 is that you can get rid of all of that plastic that was on the other dentures. This is a bridge, it's made of porcelain. It still has the housings on the inside here, and it just simply snaps on to mini dental implants.
It's bad going through life having to cover your face because you're embarrassed of your teeth. It wasn't comfortable at all. I didn't want dentures. I had the fixed on 6 done. It was easy. It literally changed my life. I can eat anything now. I can smile, I laugh. I don't have to cover my face anymore. It was awesome.
And if God gave us our baby teeth and our adult teeth, Dr. Bob Harvey, you're going to show us the next mini dental implant example, which is called a roundhouse, which is like a third set of teeth.
Now, this is an example of the finest product that we're capable of producing today. The difference that lies between the fixed on 6 and this product is that we incorporate a few more mini implants. Because we're cementing this on. This does not come in and out. It is solid, it has no play to it, and it is as close as we can get to giving you back your teeth in today's technology.
You know, people who maybe neglect missing teeth or neglect problem teeth, particularly those that are in the back of your mouth. The mini dental implant will not only fix teeth that are in the back, but also a single tooth example. Why don't you show us?
80 to 90% of our chewing is done in the posterior, in the back of the mouth. So it's very important to replace those teeth there. Here's a model of an area where a patient has 3 teeth missing and 4 dental implants are placed to replace those teeth. Crowns are simply made and they are cemented onto the mini dental implants.
And what's important to note, Dr. McNair, not only the teeth that are in the back for the chewing, but if they're gone, the face kind of gets sucked in and you age much quicker.
Yes, yes.
And if you have a single tooth that's fallen out, it's been knocked out in a sporting or a fishing problem, and you're looking for a single tooth example, the mini dental implant will help.
Here is a model of the replacing 1 tooth with the mini dental implant.
So the titanium post goes in and the tooth is custom designed, and look how that fits right in.
Yes.
And these are made in America products and it's custom designed for the patient. This is not something that comes out of a box and you place it in the patient's mouth.
Yes, and it's a lot less invasive than placing a bridge here, and less expensive too.
And that's what's important to note about the mini dental implants. They're less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive.
Getting the mini dental implants was a life changer for me.
If you're concerned about your looks, then obviously this is the way to go.
Not a second thought about it. I would do it again. This is something that is so incredible.
I feel a lot more confident. My smile feels better.
And it brought a lot of confidence back to me.
It's just amazing what it does for your self-confidence and how you feel about yourself.
I am very happy I had the procedure done. I feel as though I have my smile back.
It's just unbelievable what it's done to my life.
I feel like I do have more confidence than I did before.
It's going to sound corny, but I mean, it is a life-changing event.
Changed my life.
And that's why the mini dental implant will change your life. You can be you again. Now, we promised doctors to get to know you a little bit because, you know, it's important for our patients out there to meet the dentists who are here on Innovations in Health. And I think it's very important to note that you've been practicing for a while. Dr. Bob Harvey, how long have you been practicing as a dentist?
Well, let's see, it's going on 41 years.
That's terrific. And, you know, Dr. Rameek McNair, how long have you been practicing?
A little over 20 years.
So how did you both connect and meet each other to start working with your practice at Aspire Dental Group?
Well, Dr. Harvey placed an ad in the ADA, and I saw it, and I went to Lake City to meet with him, and we just hit it off. And
And partners ever since.
Yes.
Now, Dr. Bob Harvey, I know you told me that Dr. Rameek McNair is your go-for-it guy. What does that mean?
Oh boy, he came out of the gates, and this man, he loves doing dentistry. He works very hard, and he takes care of his patients, doing marvelous things.
And what's terrific about your family, for the both of you, is you care about your families, of course, and you care about the families of your patients. And I know that that's what's most important about the Aspire Dental Group. You make it work for the family and the working individual and the people who have adjusted schedules. And Dr. Bob Harvey, talk to me about how you work together to make your group so affordable, and with your positioning line, which I love, you'll strive to see you today or tomorrow.
That's our motto. We strive to see you today or tomorrow. Well, we have a unique situation where we office share. And what that means is that either Rameek is working or I am working, but we never work together. And so one is there 3 days a week, Monday through Wednesday, or the other one maybe Thursday through Saturday. And because of that, since we have so many office hours, we're capable of accepting emergency patients in short notice, and which is nice. And we also have extended hours. So for those who like to come in early before work, we have 8 o'clock appointments. For those who need to come in after work, we work until 7 on some days, and working Saturdays just works for everybody.
And Dr. McNair, I think that's very important to note, because people's schedules are such that with work and life in general, that you need to take the time, don't you, to come and see the dentist if you have a problem. You shouldn't put it off, and this flexibility makes it work for them.
Absolutely.
It does, and you should note that Dr. Bob Harvey and Dr. Rameek McNair are at Aspire Dental Group, a mini dental implant center of America, home of affordable dental excellence. They're at 1788 Southwest Barnett Way in Lake City, Florida. Here's the phone number to call. It's been on the screen. It's 386-217-1248, and online at aspiredentallakecity.com. And the mini dental implant procedure is what we're talking about. It's going to change your life. And I know that both of you doctors go up to Buffalo, New York, and you get the chance to meet with Dr. Todd Shatkin, who has been an innovator in health with the mini dental implant. Dr. Bob Harvey, talk to us about that connection and why it's so significant with all of the technology and knowledge you bring back here to Florida.
Well, my brother, Greg, practices in Wisconsin, and he is the lead on this. He discovered Dr. Shatkin a few years ago. And he said to me, geez, Bob, you really need to look into this. This is cutting edge stuff, and you're into that, and this is something that you really need to see. So having placed implants for 35 years or so, I decided, okay, well, let's look into this. And so I went to his first course, and that piqued my interest, and I went to an advanced course, and this is really where it came to light, and it just came down. Todd is so much on the forefront and so far ahead of the curve on this subject, and teaching his people how we can use mini dental implants in a variety of situations and eliminate a lot of times grafting and doing things that patients really don't want to like to have done, and the dentists don't want to do. So it opened up a new vista for me, because I went from a practice where we did nothing but 2-piece implants to minis, and I'm doing almost exclusively minis, and there's good reasons behind that.
And Dr. McNair, I know that when you go up to Buffalo and you're learning from Dr. Todd, you're really meeting with other dentists as well, so you really have bonded with all of these other dentists, and you're learning from each other.
Yes, it's like a great big family. And I tell you, since we've started doing mini dental implants in this capacity, it has been so fulfilling being able to restore areas that we once prior would not be able to restore with fixed dentition.
And you're learning, and you're gaining that knowledge, and you're bringing it back, and you're always learning. And Dr. Bob Harvey, you've been, as you mentioned, you've been in practice a while, and the technology is such that it constantly changes. And I know that you use what's called the cone beam, which sounds like something out of a science fiction movie. How does that work with the patient?
It's very similar to what you have at a hospital for a CT scan. And what it does is it gives us a 3-dimensional picture of the patient, so that we're capable of determining where is a good place, a safe place to put these implants. And where we think there wasn't bone, we find bone. And that's the whole key, is to know where to place the implant successfully.
And I know that you make this affordable for the patients. And I know when you go to the website, aspiredentallakecity.com, there's all kinds of information on the website. And part of that includes what you would do for the new patient. You know, we're used to paying for our home with a mortgage and our car monthly, but this is an investment in yourself, but you're making this affordable, aren't you, Dr. Bob?
Well, we are. And the difference is, I was trained a long, long time ago about conventional implants, and I had a great deal of knowledge. I had more knowledge than most of the people in my area, in the state of Colorado. And the problem was cost. We had this tremendous knowledge, but it cost so much, it was prohibitive. Well, learning more about the minis, we learned to make them very cost effective, and now almost anyone can afford them because we have financing programs that'll push payments out for 5-7 years, 0 interest payments. I mean, you know, like buying a car, not many people put down a bunch of cash when they buy a car. They have to spread it out. That's what we do. And this is what we do for something that is as life-changing and as important as the minis.
This was really affordable.
Yes, it's totally affordable. It's totally affordable.
I would definitely recommend mini dental implants to everyone.
Very happy with it. It looks natural, it feels natural.
I wish I would have got it done a long time ago.
It's the best decision I ever made, so it's well worth it.
And I know, Dr. McNair, part of that includes the look. So the patient is able to really get their life changed, and maybe they're going to get into a new relationship, or they're, you know, at a point in their life where they just need to kind of maybe reinvent themselves. This is something that you make it affordable because they can enjoy the foods that they want to eat, and they can be with their family again and feel confident. It must be very gratifying.
Very gratifying. Brings life back into the patient. They could smile again, they could eat again. It just changes their lives.
It does change your life. If you have a dentist already, wherever you are, that's terrific. But if you want the mini dental implant, you want to see Dr. Bob Harvey and Dr. Rameek McNair, because they are a mini dental implant center of America, the Aspire Dental Group. And in Lake City, Florida, they're at 1788 Southwest Barnett Way. That's where Aspire Dental Group is, a home of affordable dental excellence. And online at aspiredentallakecity.com. The number to call, 386-217-1248. So Dr. McNair, the people that you serve from all over, as we talked about, you've changed their lives, and I know that you have an interesting patient story you wanted to share.
Yes, a very dear, sweet lady named Pat. She was struggling with restoring her upper right area for a very long time, and the two-piece or conventional implant just was not affordable for her. And so I called her up and had her come in, and we discussed another way of doing it, another option. And we placed some mini dental implants up there, and she was so appreciative. She could not stop thanking me. She even came to tears. And, you know, it's just so fulfilling, so fulfilling.
That's an amazing story. And I know, Dr. Harvey, you have a story as well.
Yes, I had a young lady who, as a gift from her father, was going to restore her dental work. She had very severe problems because she's going to be married, and this is one of her gifts, her wedding gifts from her father. Well, we put everything together for her, and we looked, and she looked beautiful. And she took off and went to the store, and this is important to me. When she walked in, she was on the phone to her father, and the lady behind the counter, you know, her dad went, "Oh, how'd it go? How'd it go?" And she goes, "Oh, Dad, it's beautiful, it's fine." And the lady behind the counter said, "Oh my gosh, you have such a beautiful smile." And her dad started to cry. That was a poignant moment for me.
And it still strikes you so much today, and that's terrific, because not only did you give that young lady her life back, her father did as well by coming to you to set that up, and that is a part of the experience with the mini dental implant. It's something that it's difficult to put into words, but those patients not only get that sense of taste like we talked about and the ability to enjoy their food, but the ability to really regain their life.
I was in a car accident. My front tooth cracked. I'm definitely embarrassed to smile. I got mini dental implants. It changed my life because it made me feel like me. Like I can smile and feel like Ashley. I just want to say thank you. more than happy. I'm ecstatic.
And I know, Dr. Harvey, that if somebody is coming to you at Aspire Dental Group, you can work with them with oral sedation. If they have a fear of coming to the dentist, that shouldn't exist, should it?
One of our barriers is the fear factor. And I totally understand the fear factor, because when I was a kid and I had to go to the dentist for my first fillings, I have big brothers. And my big brothers told me I'm going to die. And so I went in there thinking I was going to die. And it was the worst experience of my life. So I understand the fear factor. And so we have to get past that hurdle for our patients. And we do that by giving them an oral sedation or nitrous oxide if we need be. And we try to get them over that hump. Once they go over that hump and they discover, hey, you know, I didn't like it, but it wasn't that bad, it's doable, well, then we're able to treat them. And I don't expect them to come jumping in a chair, but they're able to get their work done.
It was totally painless.
What pain? I had no pain.
I didn't have any pain.
It didn't hurt.
I never felt a thing.
There was no pain, no discomfort whatsoever.
One trip, it's great.
One visit, you're done.
Less trips, the better.
It's actually really painless, and I wish I would have got it done a long time ago.
So I did it, and I'm very happy with it.
I left again with a tooth that day. I took one Aleve that evening, and that was it. Yesterday, I had 4 implants put in here. I took 3 Aleve, and that was it. And today, it's just a little sensitive if I touch it, but I have teeth there now. It looks good.
It was good.
And that's great to know that you will work with the patient, because Dr. McNair, if there's an underlying mission here, you should not put off going to the dentist, should you?
No.
Not at all. And the mini dental implant, everybody, is 5 times less. It's less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. And when we talk about the less discomfort, doctors, that's important to note, isn't it? Because what do you prescribe and do for the patient after they go through the procedure?
Well, I tell you, John, many times patients, I call them the next day and they said, Doc, I didn't even need any of the medicine. However, we do give them antibiotic, Motrin, and
you know, a Medrol pack, which is a steroid that helps reduce inflammation short term.
Yeah, so it's very little discomfort at all. And Dr. Harvey, how do you take care of the mini dental implant?
Well, on some of these where they're cemented, what we use is just you brush your teeth. You brush your teeth with a toothbrush and you use a water pick. And it's just like having your teeth back again. You have to take care of them.
You know, if you've just been watching Innovations in Health for this half hour, you've learned all about how this is a life-changing procedure. If you joined us halfway through and you missed something, what we're about to show you will really bring home the significance of the mini dental implant. And Dr. Bob Harvey, show us the difference between a conventional and a mini dental implant.
Well, the 2 different preparations. You have the conventional and you have the mini. Which would you rather have?
The big hole or the small hole?
The big hole or the small. Which would you rather have?
And the time spent with the conventional versus the mini, it's just, there's even no example of it. It's just so far less. It's less time, it's less discomfort, and it's in-office procedure, isn't it?
It's all done by us in the house.
All right. So, Dr. McNair, when we talk about dentures and the lower denture, it's swimming around at the bottom of the gums. Show us again how the lower denture is fixed.
Place 4 mini dental implants there. Housings are on the inside, and it just snaps in.
Odds are, if you have a lower denture, you probably have an upper. And Dr. Bob Harvey, the sense of taste is now going to come back, because the foods we love here in Florida, you can now experience all over again.
Well, the palate is cut out. No more palate for you to gag upon, nor is it covering taste buds. And so you have the ability to taste better and feel the temperature of foods.
The next example is what we call the fixed on 6, and this elevates the mini dental implant to a whole different level, doesn't it?
As you can see, you can get rid of the plastic, still have the 6 mini dental implants, and have a bridge made of porcelain, and it looks great.
Looks great. And Dr. Bob Harvey, with the fixed on 6, that's one example, but if God gave us our baby teeth and our adult teeth, with this roundhouse example, this is like a 3rd set of teeth.
This is the ultimate, folks. This is what we want when we're done. This is cemented in. It's like having your teeth back again. It is creating your smile, your bite, your ability to chew. It is a personality changer. If you had some talking like this or whatever, that's done. You're now smiling, you're now the life of a party again.
Those teeth that are in the back of your mouth, you're neglecting them. You should not neglect them. Tell us why, Dr. McNair, why those back teeth are so important.
Because that's where all the work is done. That's where we eat our food 80–90% of the time. And so many dental implants can be placed in the back of the mouth to replace the dentition, and crowns are made just to simply cement them on there.
And those teeth move around. If they don't have anything to lean on, the whole mouth really gets affected by
yes.
that. I can't imagine how that must be. So don't neglect it. And if somebody needs a single tooth, whether it's in the side or the back or the front, the mini dental implant will fix this.
Yes, nice and conservatively, we can place a mini dental implant for a single tooth, and a customized crown is placed as well.
Right there, look how that fits right in. Custom designed for you, the patient, when you go to see Dr. Bob Harvey and Dr. Rameek McNair and their team at Aspire Dental Group, a mini dental implant center of America, home of affordable dental excellence at 1788 Southwest Barnett Way, Lake City, Florida. And like Dr. Bob Harvey and Dr. McNair have said, not far from anywhere. The number to call, 386-217-1248, online at aspiredentallakecity.com. And Dr. McNair, we'll start with you. What inspired you to be a dentist?
Well, I definitely have had many experiences as a dental patient first. And so growing up, I always loved healthcare. I loved science. I loved the body. I knew I wanted to be a servant. And so when I went to college, I volunteered at a dental office, and I just enjoyed what he did. He wore many hats. He's a businessman. He was an artist, and just caring for people. And you know, when I went to dental school, I just found that I had gifted hands, and so and I care for people. I want always to be a servant, and I look at dentistry as my ministry, just helping people to overcome fear, helping them to smile again, to feel great about themselves again, and it just goes into everyday life. It affects their entire life and all that they do.
Dr. Bob Harvey, what inspired you to be a dentist?
Well, it all started when I was a kid. I was 10 years old, and I was slated for braces, and I had braces put on, and you know, as a kid, you go through different professions as you grow, but my braces stood with me till I was 17 years old, so that seed was there for a long time, and I thought this is something I might enjoy. And in doing so, the rewards of helping people. I'm going on 67 years old. I'm not even thinking about retiring. It's not monetarily. It's because I enjoy what I do. You know, when I get tired of helping people, I guess I'll quit. But I'm not. I like what I do, and I'm so proud of the work that our staff can put out and do for people. It's life-changing. I mean, life-changing. And that reward keeps me going and going.
Well, we thank you for being innovators in health here in Lake City, Florida, and thank you for all that you do for all of your patients.
Thank you.
Thanks, John, for the opportunity to visit you.
It was great to meet you both, and thank you for watching.